has questions or wants to pull either of these two resolutions off a consent agenda, but they are just resolutions, and I shall read them. If you want to discuss either one, you let me know. RS 2023-1935, Rhoton and Syracuse, approves amendment number 1 to the contract between the Metropolitan Government and Concentra Health Services, Inc. for the provision of medical services. 2023-1936, Rhoton and Syracuse, approves an application for a Violent Crime Intervention Fund grant from the Tennessee Department of Finance Administration, Office of Criminal Justice Programs to the Metropolitan Nashville Police Department to provide funding related to response to and reduction of violent crime in the community by providing for technology updates, police support, and implementation of the Group Violence Intervention Program. Either one of those need to be taken off a consent agenda. Hopefully you've done your homework. Yes, ma'am, Vice Chair.
I'm not interested in pulling them off, but can we get a brief explanation for both?
Sure. And we have two guests here, so let's start with the first one, right? Which is the one with Concentra Health Services.
Correct. I'm Stephen Kane with Human Resources. Actually, this is an amendment being requested by Health Department, and I don't see their representatives here, but I'll tell you what I do know. Health Department is charged with physicals for the Metropolitan employees, for new hires as well as annual physicals on a periodic basis. They're apparently overwhelmed. They said they had limited space, so they asked Human Resources, since we are the procuring department for the Concentra contract and we have the lease for the IOD clinic, we have some extra space, and they asked if there's a mechanism for Concentra to help us, to help them, and we said sure, and Concentra was willing to do so, so we amended the contract to add additional staff and let them utilize some of the space over there at the clinic. The charges for that will not go through the IOD clinic because the injuries are paid for by the benefit board and these physicals are paid for by the health department. So all services associated with the additional work will go straight to the health department from Concentra.
Thank you.
I've been looking for you.
So this is the Violent Crimes Intervention Grant. It was the fund that was announced by the state following the kidnapping of the jogger in Memphis. And they announced that they were going to release a pool of money to various municipalities around the state. This is our application for that grant. A large amount of that is going towards our Violent Crimes Division, which is the group of officers that are tasked with locating stolen vehicles, robbers that use these stolen vehicles, carjacking suspects, that sort of thing. We also are using some funding towards the Police Activities League, which is something that's kind of near and dear to Chief Drake's heart, which involves mentoring at-risk youth. They're currently started up with a boxing program. And then we're also utilizing some of the funding for travel and training for the group within our department that's going to be involved in group violence intervention.
May I ask one question? For the group violence intervention program, who are y'all partnering with on that?
The mayor's office.
Okay. Are there any nonprofits that are getting funding?
It's spearheaded by the health department and the mayor's office, and so we have our piece, and we're kind of just a piece of that puzzle. I don't know yet who all is going to be involved in the process. We're just trying to set aside some funds so we can, visit other police agencies that have done this process and see what's worked and what hasn't worked for them.
Thank you. Chair, may I address the question to the administration?
Sure.
Thank you. For the administration, do we have any information about who will be getting the funding for the violence intervention program?
Not yet, to my knowledge. Mike Lacey has been spearheading this following Mr. Bunton's departure, and my understanding is not yet the organization's identified.
Okay, so if we pass this tonight, this is not saying that any organization will or will not get money for this program?
Correct. Other than the police department.
Yeah, this is specifically for the police department. I'm sorry, I should have clarified that.
Okay, thank you. I just wanted to make sure because it says implementation of the violence intervention program, and I know that there have been a lot of conversation about various entities getting funding. So
yeah, I'm sorry. I should have clarified that. That's for our part of that program.
Okay, thank you.
Sure, and so actually that's very good that you bring that up. So as chair of this committee, I kind of succeeded Councilmember Gamble and then Evans in being a representative of the Community Safety Partnership group, and I can give you the meetings if you all want to attend. But we are making progress towards. It's a bit bumpy, but we're making progress towards getting that underway. So. Yeah. Well, I guess technically we kind of bumped that off the consent, so let's take them one at a time then. RS 2023-1935, that's okay. It approves amendment number 1 to the contract between the Metropolitan Government and Concentra Health Services, Inc. For the provision of medical services. All in favor?
Aye.
Against? Any abstentions? Thank you. And then the one we were just discussing, RS 2023-1936, approves an application for a violent crime intervention fund grant from the Tennessee Department of Finance Administration, Office of Criminal Justice Programs to the Metropolitan Nashville Police Department to provide funding related to response to and reduction of violent crime in the community by providing for technology updates, police support, and implementation of the Group Violence Intervention Program. All in favor?
Aye.
Against? Any abstentions? It passes. Any other business before this committee? Stand adjourned. Thank you all.
Thank you, sir.
It has been a bit bumpy.